Hello viewers, this is Dr. Rajat Kumar Shrivastava, Senior Plastic Cosmetic and Reconstructive Surgeon at Charak Hospital. Today I'll be discussing about one of the common and routinely performed cosmetic surgery procedures in India, the hair transplantation. I'll broadly classify and describe or talk to you about this hair transplantation in a broad headings like why to get it done, by whom and when to get it done, which technique to adopt, are there any side effects to it, and what are the post-op care, and when to expect the results. Now, why to get it done? A lot of people are now getting the hair transplantation done thanks to the social awareness, the internet use. A lot of celebrities are getting it done. The personal aspirations, the professional demands of the jobs, and now a new perspective of having a good look is the reason why the people are getting it done. A hair transplantation decreases the age of a person by almost 10 to 15 years, giving him a new youthful look. Now, by whom and where to get it done? My humble submission to the viewers would be, get it done by a senior plastic surgeon or a qualified plastic surgeon who is well versed in this technique, who knows the intricacies and the fine delicacies of this commonly performed transplantation. We at Charak Hospital are having a fully dedicated state-of-the-art hair transplantation unit with a fully dedicated team where we are performing small to mega sessions, that is more than 3,000 to 3,500 and up to 4,000 and beyond in a single sitting in a single day, giving a very natural hairline and a very good to excellent density depending upon the patient conditions. I, as a plastic surgeon, have operated more than 1,500 cases till date, providing satisfaction to the patients. Now, which technique to adopt? Broadly classified, there are two techniques. One is the FUE, where we take out hair follicles by a trimmer, and there is the another technique where we take out a strip, what is the gold standard hair transplantation, the FUT technique. Every patient is not qualified for a FUE or a FUT, depending upon the grade of male pattern baldness. Grade 1 to 3 are generally we prefer to do FUE surgeries, depending upon whether the patient has good donor hair density. Grade 4, we generally perform FUT, that is we take out a strip, and so that a patient can again have further sessions for the future. Grade 5, 6, 7, we generally perform FUT plus FUE combined, where the demand is huge and the supply is less. So from wherever we can get, we take the follicles, that is in the back of the scalp, the beard, the chest, so that we can provide maximum coverage to the patient. We have devised special painless techniques, minimizing the pain factor to almost negligible for the patients. And the entire 7 to 8 duration is almost pain-free for the patient. Now, are there any side effects? No, there are no side effects to this surgery. Any post-op care? Yes, very minimal post-op care. Just like preventing any rubbing of the scalp for 1 to 2 days, how to do the head washes. These are the only minor post-op cares which the patient needs to be explained and which the patient can do on its own. Does the patient need any bed rest? No, patient does not need any bed rest. It's a daycare surgery. The patient can get it done and go home the very same day. And from the next day, he can perform his day-to-day activities. He can even join his work the very next day. Now, when to expect the results? Once the hair transplantation is done, the patient can go back to home, and within 15 days, the hair transplantation sites, they appear as a small scabs which shed off on their own during the head wash, or may need to be gently rubbed off after 13 to 14 days, so that the scalp is now clean, and the results start to appear they begin to appear after 3 to 4 months, And by 6 to 9 months, you can see the full result of the hair transplantation when the hairs achieve a length of 5 to 6 centimeters and they are covering each other to provide a good result.